Namaste JVN, myself JVN Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine and Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jaipur. In this series of lectures, we are discussing about the various respiratory diseases. This is the topic that is covered in the BHMS third year and the first session that we are going through. So, in the respiratory system, today we are going to start with pulmonary tuberculosis. Tuberculosis. What is tuberculosis? How it is caused? What are the clinical features? The investigations and management of tuberculosis, all these things we are going to discuss in today's lecture. Tuberculosis is a disease that is caused by Mycobacterium tuberculosis. Mycobacterium tuberculosis is a bacilli, is a rod shape, acid fast, aerobic and non-spore forming bacilli. So this is a bacteria that is aerobic, that is requiring oxygen, non-spore forming rod-shaped bacilli that affects the lungs. It can affect multiple organs of the body, but most commonly it is affecting the lungs. Therefore, the most common type of tuberculosis we observe is pulmonary tuberculosis. Pulmonary tuberculosis when it is affecting the lungs, therefore pulmonary tuberculosis. There are other sites also which are affected, which includes the brain. We also have cardiovascular system, we have gastrointestinal system, genitourinary system and bones and joints. These are the common sites which are also affected by the pulmonary tuberculosis. Now, what happens in pulmonary tuberculosis? In case of pulmonary tuberculosis, the bacilli, it comes or it affects the lungs. These are the lungs which are affected by the pulmonary tuberculosis. The bacilli, the pulmonary tubercular bacilli reaches the alveoli of the lung, and when it reaches the alveoli of the lung, it is coming by the droplet infection. Droplet infection by coughing, by sneezing and by speaking from the infected organism, infected person. So this Mycobacterium tuberculosis, this is lodging in the lungs, and whenever it comes in the lungs, it starts the inflammatory response. Various lymphocytes and macrophages, they come in contact with this Mycobacterium tuberculosis to stop its spread. When the lymphocytes and macrophages come in this, then this leads to the formation of a granuloma. Now, what is a granuloma? Granuloma is nothing but the replacement of the normal lung tissue. Replacement of the normal lung tissue by the fibrous tissue. So, this normal lung tissue is replaced by the fibrous tissue, and this granuloma is formed at the apex of the lung. When multiple granuloma comes together, multiple granulomas are formed, they form the primary lesion. Primary lesion, and it is also known as Cohn's focus. This is the Cohn's focus. When multiple granuloma are formed in the lungs, because this is an aerobic bacteria, so it is mainly found on the apex, on the top of the lungs. This top of the lungs are affected. This leads to formation of Cohn's focus. Cohn's focus is yellow colored caseous lesion. because of the presence of bacteria and pus formation. This is a yellow color and caseous lesion, and which calcifies later on, leads to the formation of a calcified nodule. This calcified nodule in the apex of the lung represents the tubercular focus or the history of tuberculosis. So this is the pathophysiology, how this is formed. Now, what happens in this tuberculosis when this Mycobacterium tuberculosis lodges in the lungs and it forms initially the primary lesion, then granuloma formation, then it forms the primary lesion or the Gons focus, multiple Gons focus along with the lymph node. Gons focus, or also known as primary lesion. This combines with the regional lymph nodes to form the primary complex of Reinke. So what was happening is, first of all, there is formation of granuloma. First of all, this bacteria is lodging in the alveoli of the lungs. This leads to formation of granuloma. This granuloma leads to formation of primary lesion. This primary lesion forms the Gons focus. This is also known as Gons focus. This forms primary complex of Reinke. When this Gons focus combines with the regional lymph nodes. So this is about the pathophysiology, and this primary complex of Reinke undergoes calcification to form the calcified lesion. This is the whole pathophysiology of tuberculosis. Now, let us try to understand what are the clinical features of pulmonary tuberculosis. The pulmonary tuberculosis can be divided into three parts. We have primary, we have miliary, and we have post-primary tuberculosis. What happens in primary tuberculosis is the individual is affected for the first time with the Mycobacterium tuberculosis. In case of miliary tuberculosis, there is blood-borne dissemination, and this is spread in the whole body. And post-primary is when a person who was initially affected with pulmonary tuberculosis is cured, treated, and then again the individual gets affected, or there is already a bacteria that is lodged in the body that was in latent phase and it is again reactivating. This leads to development of post-primary lesion. Now, what are the clinical features of primary pulmonary tuberculosis? In case of primary tuberculosis, the symptoms are not very vast. These are the initial symptoms, which includes febrile illness. This febrile illness is self-limiting. Self-limiting means this is cured on its own. The fever is coming, but it is getting cured on its own after some time. There is lymphadenopathy. We have primary complex that we have just now discussed. We have influenza-like illness. Influenza-like illness. Also, there is pleural effusion. And erythema nodosum. So these are the features of primary pulmonary tuberculosis when the tuberculosis is coming for the first time. We have self-limiting febrile illness, lymphadenopathy, primary complex formation, influenza-like features, pleural effusion, erythema nodosum, and also there is consolidation of the lungs. So these are the features of primary pulmonary tuberculosis. Next we come to the miliary tuberculosis. Miliary tuberculosis, when the tuberculosis is spread and then the symptoms are present. This is most important. Fever for 2 to 3 weeks. Here we have cough, dry cough, weight loss, anorexia, and night sweats. These are the clinical features, typical features of the symptoms affected person affected with miliary tuberculosis. Also, why it is known as miliary tuberculosis? Because we have millet-like spots. Millet-like spots that is apparent on the lungs, on the lung fields, because of the presence of the calcified lesions. So in the miliary tuberculosis, we have blood-borne dissemination. There is fever for 2 to 3 weeks, dry cough, weight loss, anorexia, and night sweat. These symptoms are present in case of miliary tuberculosis. Then the post-primary pulmonary tuberculosis, as we have discussed, this is seen in those individuals who were already affected by pulmonary tuberculosis, and there is reactivation. So the symptoms are developing slowly. This is taking a long time for development of symptoms, but the symptoms are more severe. Here we are going to see hemoptysis, cough with hemoptysis. Again, there is pleural effusions. We have more degree of degeneration of the lungs. We have consolidation. We have cavitation, and we have collapse in case of post-primary tuberculosis. The symptoms are developing slowly, so it is taking a lot of time to develop, and more damage to the lungs are seen. So this is about primary, miliary and post-primary tuberculosis. Now, how to diagnose a case of pulmonary tuberculosis? Before that, let us just understand the extrapulmonary features. Extrapulmonary features of tuberculosis. As we have discussed that the tuberculosis is also affecting the CNS. It is affecting the pericardium. It is also affecting the abdomen or the gastrointestinal system. It is affecting the genitourinary system. It is affecting the bones and joints. So what happens in CNS? In the CNS system, we have headaches, we have seizures that are commonly seen. In pericardium, we have pericardial effusion. In the gastrointestinal system, there is mass formation or nodule formation is there. Also, we see obstruction and anorectal ulceration. In case of genitourinary, we have dysuria, we have hematuria. Hematuria is blood in urine. In the bones and joints, we have pain, bony pains and arthralgias. Mono, single joints affection is commonly found. So these are the extra-articular or extrapulmonary features of tuberculosis. Now, how to diagnose a case of pulmonary tuberculosis? The diagnosis is mainly by the symptomatic way. Cough that is coming for 2 to 3 weeks. Unexplained weight loss. Apart from this, we can go for chest X-ray. X-ray chest, PMG. In the X-ray chest, we are going to see the cavitation, we are going to see the consolidation, cavitation and the collapse. Apart from this, we can go for sputum examination, sputum microbial examination, and also we can go for skin testing. Skin test for mycobacterial tuberculosis. So we have to check for X-rays, sputum, skin, cough for 2 to 3 weeks, and explain weight loss. Now we come to the treatment part. The treatment of pulmonary tuberculosis consists of antitubercular treatment. That is the most widely used treatment, antitubercular treatment. This treatment goes for 6 to 9 months, around the duration of 6 to 9 months. This has to be completed. The medicines are usually available free of cost in the market by the government supply. If this treatment is not completed or if this is not followed properly, then this leads to development of MDR TB. This is known as multi-drug resistant TB. This is very difficult to treat. Next we come to homeopathic treatment. Homeopathy has a very good role in the management of pulmonary tuberculosis. There are various homeopathic medicines which can be given on the basis of symptom similarity. Most important medicines are arsenic album, arsenic iodine, calcarea iode, ipecac, antimars, phosphorus, balsamum, peruvianum, and sulfur. These are most important medicines that are commonly prescribed to the patients of pulmonary tuberculosis based on the symptom similarity. So, this was all for today. I hope you must have understood this session properly. We will be meeting in the next session with a new important disease condition. The therapeutics, the medicinal explanation of all these therapeutics will be covered under the session of therapeutics. So, this was all for today. Thank you very much. Have a good day.